Hello everyone. As we move along, we're still in the axial musculature, but now we're going to be talking specifically about the trunk muscles. We can divide the trunk muscles into three different categories. Trunk can also be called a torso, so keep that in mind. But the trunk or torso muscles can be divided into the thoracic cage muscles, which will include internal and external intercostals, and the diaphragm. Then we have the back muscles, which are going to be divided into intrinsic and extrinsic muscles. The intrinsic will be part of the axial skeleton, which is what we are going to be talking about, and the extrinsic muscles are part of the appendicular skeleton, and we're going to cover those on the next learning outcome. Then we have the abdominal muscles, which can be either anterior or posterior, and these will have, of course, different functions depending on where they are going to be located. Starting with the internal and external intercostals, the name is already telling you exactly where it is located. So inter means between, and costals are the ribs. Therefore, these muscles are going to be located in between the ribs. And like the name says, there's going to be an internal one and external one. The external intercostals are going to be located laterally on the sides of the body, and the internal intercostals are going to be located medially near the sternum, as we can see right over here. We do have a third layer of muscle in this area that's called the innermost intercostal, or also known as the transversus thoracis muscle, and this one is going to be located deep to both the internal and external intercostals, so more posterior to it, and this means that it's going to be covered by the serous membrane or the pleura that's going to be lining the pleural cavity where the lungs are going to be located. But for us, we're mainly going to focus on the external and internal intercostals. As we can see from this image over here, the red will be representing the origin of the muscle, and the blue will be representing the insertion. And the external intercostal is going to originate, as we can see, on the inferior border of the rib above, and it will insert on the superior border of the rib below. Therefore, when they contract, they will elevate the rib, and they will create a wider space between the ribs. On the contrary, the internal intercostals, they originate on the superior border of the rib below, and they will insert on the inferior border of the rib above. Therefore, when this muscle contracts, it will depress the ribs, and therefore it will create a small space between the ribs. Also notice how the fibers of these muscles, they run in opposite directions. One is going to run towards the midline, which is the external intercostal, and the internal intercostal will run away from the midline. On the bigger image, we can definitely see the internal intercostal over here, and it will be pulling the ribs down, therefore depressing the ribs. And the external intercostals will be elevating the ribs, so it will create a wider space in between the ribs. And the way that I remember is that external starts with E, and elevation also starts with E. Therefore, the external intercostals will elevate the ribs, and the opposite will happen to the internal intercostals. Therefore, they will depress the ribs. And as you can imagine, these muscles will be important for respiration, and we will talk a little bit more about this definitely in the respiratory system, but I will show you a couple slides how this will work as well. Here we have the diaphragm. I definitely don't want to get into a lot of details about the breathing mechanism, but I do want to cover a little bit about the diaphragm here. As we can see, it's going to be this big muscle that has this dome shape like format. And once it contracts, what it will do is that it will bring this muscle down, therefore allowing for you to have extra space in the thoracic cavity to accommodate for the lung expansion. So when you breathe your air in, when you inspire the air, your lungs fill up with air, and therefore you need more space in the thoracic cavity. Once the diaphragm contracts, it brings this top part up, and therefore you create more space in the thoracic cavity. So that's the function of the diaphragm. In addition to this very important function, the diaphragm also has three main openings that are important, as we can see over here. The first one is what we call the caval opening. Caval because the vena cava, which is more specifically the inferior vena cava, that's bringing the blood from the abdominal cavity all the way up to the thoracic cavity to drain into the heart, will be passing through this opening. So that will be your caval opening. Then we have another one that's called the esophageal hiatus, and like the name says, the esophagus will pass through it. So the food that you eat from your oral cavity will go down the esophagus and empty on the stomach that will be located right over here. Therefore, you need to have an esophageal hiatus to allow the contents to come into the stomach. The last one is what we call the aortic hiatus, which will have the passing of the aorta, which is the artery that will be taking the blood from the heart down to the abdominal cavity. More specifically, this will be the descending aorta that's taking the blood filled with oxygen to the structures that are below the diaphragm. I also want you to notice how the diaphragm will actually be the muscle that will separate the thoracic cavity from the abdominal cavity. This image is going to show you exactly how the diaphragm will oscillate or move during inspiration and expiration. Here it's actually showing maximum inspiration and maximum expiration. Inspiration means that you're bringing the air into the lungs, and expiration means that you're blowing the air out of the lungs. Therefore, maximum is when you take a deep breath with regards to inspiration, and maximum expiration is when you release all the air forcefully out of your lungs. As we can see, the inspiration is represented in red. Therefore, if this would be the baseline of your diaphragm, you can see how when you inspire, the diaphragm comes down, and this increases the thoracic cavity to allow for the expansion of the lungs. When you expire, you're going to be emptying your lungs, and therefore the diaphragm can come and relax all the way up, and this will decrease the amount of space that you have inside of the thoracic cavity. And what will help also with this expiration and inspiration are the intercostals. Therefore, the external will elevate the ribs and make them increase in size, therefore expanding the thoracic cavity. And the internal intercostals, they will move in the opposite direction, so they will depress the ribs. There is a mnemonic that you can use to remember this as well, besides just thinking that the external intercostals will elevate. You can sing the Old MacDonald Had a Farm song. So Old MacDonald had a farm, E-I-E-I-O. So E-I-E-I-O. External intercostals elevate during inspiration. Oh. Therefore, here we're adding the inspiration part, which makes sense, right? Because when you inspire, you need more volume to accommodate the inspired air. Here we can see the intercostals in more details. These will be your external intercostals. Notice how the fibers are going towards the midline. And on the other side, we can see the internal intercostals. Notice how they're going away from the midline. And on this image to the right, I have highlighted it. And these are basically the ones that are on the posterior side. So they're going around like this in circles, because they will be between the ribs. So follow the ribs and you will have internal on the inside external on the outside. This is the example that we have for the lab model. Notice how this is the cartilage and these would be therefore the ribs right over here. The intercostals are going to be located between the ribs. So these over here would be your external intercostals. Notice how there's a little line over here dividing them. And these would be your internal intercostals. Over here we can see the line as well. So these will be your external intercostals over here. And this little bitty part over here would be your internal intercostal. Let's move on to the back muscles. Like I said, we have two different types of back muscles. We have what we call the extrinsic back muscles and the intrinsic back muscles. Extrinsic just tells us that they will be acting outside of where they are located. So they will be acting on the upper limb. Why is this? Because they will be inserting on the bones of the upper limb, more specifically on the humerus. So all of these, they will have an action on the arm or the humerus. However, because they originate on the vertebrae or the ribs, then we consider them part of the back muscle, and that's where they're going to be located. So when we get to the next learning outcome, we will be talking about these muscles. Here we're going to focus on the intrinsic muscles, which will be the ones that will move the axial skeleton. Therefore, they will originate either on the vertebrae or the rib, and they will also insert on the vertebrae or the rib, but further down. And as you can imagine, they will help to stabilize the axial skeleton. The one that we want to focus on is what we call the erector spinae group. Why is it a group? Because it's made up of three different muscles. These are going to be the spinalis, the longissimus, and the iliocostalis. If you look on the image, you're going to have the spinalis, which is going to be this one right over here, and it's closer to the spine, therefore it's called the spinalis. The one in the middle is what we call the longissimus. And why is it called longissimus? Because it's the longest of them all. And the one that's more lateral is what we call the iliocostalis. Ilio for ilium, therefore it will originate over here on the ilium, and costalis because it's close to the ribs since it's more lateral. Therefore, all three will pull when they contract and they will extend the torso. In other words, they will erect your spine. That's why it's called the erector spinae group. Another muscle that we can talk about is the serratus posterior, which is going to enlarge the thoracic cavity, and also it will function to elevate the ribs, so it will help with respiration as well, in addition to stabilizing the axial skeleton. And because it originates on the vertebral column and it inserts on the ribs, it will pull in this direction. Here I have dissected all three muscles of the erector spinae group. The spinalis, you can see how it's very thin and narrow, and it's right in the midline. That's why it's called spinalis. But it will insert above on the cervical, and it will originate down here on the lumbar. Therefore, it will pull the muscle in this direction, erecting the spine. The longissimus, you can see how long it is as it starts all the way up in C1 and it goes all the way down to the sacrum. And again, it will be the one in the middle and it will erect the spine. Same thing with the iliocostalis. It will insert all the way up here in the cervical region, but it will originate on the iliac crest of the ilium. Therefore, it's called iliocostalis, but it will have the same function as it will erect the spine. Here for the lab models, the model on the left is going to be easy for you to recognize the erector spinae group and the serratus posterior. So right over here, this would be your erector spinae group. You can see how it's divided into three lines. This one would be the spinalis, the one in the middle, the longissimus, and the one that's more lateral would be the iliocostalis. And the serratus posterior are these right over here. They will originate on the vertebrae and they will insert posteriorly on the ribs. So these will be your serratus posterior. And covering this, you will have this big muscle over here, which is the latissimus dorsi, which we will cover later on. And here you can see a little bit of the latissimus dorsi. On the next model to the right, we can see this will be your vertebrae right over here. This is the transverse process of this vertebrae. This would be the body. This would be the spinous process. Notice how it's posterior. So your erector spinae group would be all these over here. And it's divided into spinalis, longissimus, and iliocostalis. Next, we get to the abdominal muscles, which can be divided into anterior abdominal and posterior abdominal muscles. The anterior abdominal muscles, I think, are the muscles that you guys are more used to hearing about, which are your obliques. There are two obliques, the external, the internal. Then you're going to have another muscle that's called the transversus abdominis and the rectus abdominis, which are your abs or six packs. Then we have the posterior abdominal muscles, which are going to be the iliacus, the psoas major, and the quadratus lumborum. Let's identify these muscles on these images. So right over here is your rectus abdominis. You have one part, which would be the left side, and here you can see a little bit of the right side of the rectus abdominis, which are your six packs or your abs. And over here to the side, you're going to have the obliques with the transversus abdominis. And they're called obliques because the fibers run oblique. So the one that's more outer is going to be the external oblique. The one that's in the middle is actually called the internal oblique because the one that's more internal is actually called the transversus abdominis. And it's called the transversus abdominis because the fibers run transverse. On this insert, we can see the transversus abdominis. Notice how the fibers run transverse. On the outside, the external oblique. Notice how the fibers run oblique. And then the internal oblique, the fibers also run oblique, but in an opposite direction compared to the external oblique. So always pay attention to the layering and the orientation of the fibers. And don't call the transversus abdominis the transversus abdominis oblique because it can't be transverse and oblique at the same time. So to summarize, laterally you're going to have three layers, which are the external oblique, the internal oblique, and the transversus abdominis. And anteriorly, you're going to have two sheets of muscles, which are the rectus abdominis on the left side and the rectus abdominis on the right side, and they are going to be divided by a sheet of tendon, which can also be called the linea alba, which is the line right in the middle of your belly. Now, everybody has all of these, but in some you can see and in others you can't. It all depends on the amount of fat that you accumulate in this area. And over here we have what we call the posterior abdominal muscles, and the first one is what we call the quadratus lumborum. So it looks like a little square on the lumbar region, quadratus lumborum. Then the one that's right here medially is what we call the psoas major. And this one over here that's on the iliac fossa is going to be what we call the iliacus. Now the psoas major and the iliacus will come together after it passes this line over here, which is called the inguinal ligament, and it will become the iliopsoas muscle going down to your femur. Now, because these muscles, they originate further down than they insert, it means that they will pull muscles down and therefore flex at the torso, besides doing other functions, which we will see in the next following slides. These are just different images for us to better understand these muscles. So the outer muscle that's right in the middle is going to be the rectus abdominis. Then you're going to have the external oblique, which will run externally lateral. Below it will be the internal oblique, and below the internal oblique will be the transversus abdominis. Notice how the fibers run transverse. In the posterior wall, you're going to have the quadratus lumborum, which is a square in the lumbar region. Then you're going to have the psoas major, which is this long, thin muscle that looks like the filet mignon, right, of our body. This is your psoas major. And then on the iliac fossa anteriorly will be the iliacus. And these two, once they pass the inguinal ligament, it will become the iliopsoas muscle that will then insert onto the femur. Again, another image of the iliopsoas muscle group, the psoas major, the iliacus. After they pass the inguinal ligament, they become the iliopsoas muscle. And guess where they will insert? On the lesser trochanter of the femur. Here we have the lab models. We can start by adding to this transverse cut over here. Remember, this was your erector spinae group. Therefore, this is posterior and this is anterior. And this part over here will be lateral. And how do I know that this is lateral? Well, remember that I said on the previous slide that this would be your vertebrae, and the vertebrae are medial. Therefore, this area over here would be medial, and this would be lateral. So on the lateral part, that's where we have your obliques, right? Notice how there are 3 layers of muscles over here. The one that's more outer will be your external oblique. The one that's in the middle will be your internal oblique. And the one that's more internal is your transversus abdominis. And anteriorly, you can see the rectus abdominis right over here. So this is your rectus abdominis. Now let's go back to this other model on the right, and then we can go back to the model on the left. Here you can see your psoas major. This would be your iliacus on this side. And the little square in the lumbar region will be your quadratus lumborum. So quadratus lumborum, psoas major, iliacus. Notice how you can see a little bit of bone over here. And what bone is this? Well, this is your ilium. And what bone feature is this? It's your iliac crest. So if we transfer the iliac crest on this model to this model on the left, this would be your iliac crest. I know it looks like a rib, but it's not a rib because it's on the lumbar region, right? Aren't these your lumbar vertebrae? Look at the sacrum down here. So this is not a rib. This is the iliac crest of the ilium. Therefore, this is your iliacus muscle right over here, iliacus. Now we have these 2 muscles over here that we can already identify. And how are we going to identify them? Now notice how you have this organ over here. Anybody knows what this organ is? This is going to be your kidney. Notice how on this image you can see your kidney right over here. Now let's look how the kidney is with regards to the muscles that we have talked about already. So the kidney is this organ right over here. And notice how the quadratus lumborum is going to be lateral to the kidney and posterior to the kidney. I don't know if you guys can realize, but the kidney sticks out a little bit more anterior and the quadratus lumborum is posterior to it, but it's more lateral compared to the psoas major, which is medially. So when we go over here on this left model, again, this would be your kidney. Notice how this muscle over here is posterior to the kidney because this is anterior and this is posterior. Therefore, this muscle over here is going to be your quadratus lumborum, and this big muscle right over here is going to be your psoas major because it's more medial compared to the kidney, right? So the kidney is over here, kidney, and the psoas major is more medial compared to the kidney. So this would be your psoas major, and this one over here is your quadratus lumborum. In addition, in this model, we can also see the 3 layers that are lateral: external oblique, internal oblique, and transversus abdominis. Notice how the transversus abdominis, which is this last layer over here, has its fibers running transverse. So this is your transversus abdominis. In the middle, you have your internal oblique, and laterally, you're going to have your external oblique. Also on this image, we can see the ribs. So these are your ribs. Therefore, the muscle in between the ribs are going to be your external and internal intercostals. They will have a little line over here that will separate outer external, inner internal intercostals between the ribs. And the last muscle that we can see on this model is going to be this one that separates the thoracic cavity from the abdominal cavity, which is the diaphragm. So all of this will be your diaphragm. With regards to function, neutral is going to be your anatomical position. If you are in this position over here and you want to go back to anatomical position, or if you're in this position and you're bending down also, or bowing, you're going to have the function of the rectus abdominis and the psoas major. They will pull in this direction, as we can see over here, and therefore they will decrease this angle over here of the torso. In addition to these muscles, all your obliques and your rectus abdominis will also help to flex the torso. So your external oblique, your internal oblique, and your rectus abdominis all perform flexion at the torso. Your transversus abdominis, because the fibers run transverse, they will only compress the abdomen. So they won't help with flexion of the abdomen. Now, if you are now in a flex position because your torso has a smaller angle when compared to the neutral, for example, then you're going to extend your torso by bringing it back to anatomical position. And the muscles that will perform this function will be, in most part, your erector spinae group. So your iliocostalis, your longissimus, and your spinalis. Of course, it is important to bring up that this would be your flex position, this would be your anatomical position, and this is your hyperextension, right? Because you're extending it past the anatomical position point. So if you are in a flex position and then you bring it back to your neutral position, this is already an extension from the flex position. But if you bring it further back, like you can see over here, this would be starting from a hyper extended position and not an extended position. With regards to lateral flexion and rotation, lateral flexion is going to occur due to contraction of the obliques and the quadratus lumborum, and rotation will be done by contraction of the iliocostalis, the longissimus, in addition to internal and external obliques. If we want to summarize, your obliques will help with lateral flexion and rotation, both the internal and external obliques. For lateral rotation, think of it this way. The quadratus lumborum, remember how it's lateral to the kidney, therefore it will help with lateral rotation. And the iliocostalis and longissimus, because it's right close to the spine, so the midline, it will help with rotation.